Do you know 50% of what you pay for your medicine actually goes to doctors' pocket? Last year, the Chinese has been outraged by a vaccine scandal. Changshen Biotechnology, known as China's vaccine king, was found to sold more than 250,000 substandard vaccine doses. But if we take a closer look at the company's annual report, we can find that the company's problems go far beyond the fake vaccines. The company spent $86 million on marketing in 2017, and basically this large amount of money was used for product promotion and sponsoring meetings, like extra payments given to doctors to secure sales. As we can see in this graph, the company's selling expense has jumped fourfold in just 3 years, and by the end of 2017, it accounted for over 60% of their operating expense. And you know what? This company only has 25 salesmen, while its selling expense in 2017 is $86 million. That means each guy spent $3 million. As a high-tech vaccine manufacturer company, Changshen's main cost is not R&D expenditure, but selling expense. And a large proportion of its selling expense is advertising and promotion fee, which accounted for over 80%. So, where does this huge expenditure go to? Actually, most of this money goes to the pockets of doctors, hospital, distributors in forms of gifts, vouchers, and even cash-filled envelopes. For example, there has long been some special patients who do not look for medical treatments but make shady deals with doctors. In China, we call them medical representatives. Their job was to find out what and how much medicine the doctor was prescribing, and mostly to give kickbacks to the doctors secretly in forms of envelopes. According to the news report, the bidding price of a drug that used for treatment of allergic rhinitis is $19, while the kickback to doctors is $6. Basically, in pharmaceutical industry, there is a hidden rule that the minimum kickback rate is 30%, while the maximum kickback rate can up to 50%. Essentially, this is what we call rent-seeking activities in economics. The rent comes from doctors' power to prescribe, and the rebate money is what we call the rent. In other words, 30 to 50% of what you pay for your drug is actually the rent. But why does the drug company choose to rent-seeking? Obviously, that's because, compared to R&D, the effect of kickback to doctors are more straightforward. If you invest in R&D, on one hand, it's a long journey. Do you know how long it will take from molecule to medicine? According to Roger, on average, it takes $100 million, 7 million working hours, 6,000 experience, 400 researchers, and roughly 15 years for only one medicine. However, on the other hand, even though you spend so much resource and effort on R&D, you cannot ensure 100% of success, as you are faced with high possibility of failure at every stage. The truth is that you only have at most 0.1% probability to survive the first stage. Therefore, R&D's uncertainty and time cost is super high. However, when you go for rent seeking, things are different. Kickback to doctors can encourage doctors to prescribe my company's medicine more, thus increasing my sales directly. Therefore, as long as there is room for rent seeking, pharmaceutical companies' incentive to independent innovation and R&D is really low. For a long time, Chinese pharmaceutical companies have paid little attention to R&D. Our pharmaceutical companies spend less than 1/6 of the gross average level on R&D. And the proportion of R&D expenses in revenue is less than half of the gross average level. Compared with Hengrui, which is China's top 1 pharmaceutical company and has overwhelming R&D capability, Changsheng spent far less proportion of R&D in revenue. As a result, Hengrui's core competitiveness is superior to Changsheng. As reflected in the stock market, Hengrui's stock price has increased by more than 100 times since IPO, while Changsheng dropped by 80%. What's worse, Changsheng was forced to delist at January 2019. In conclusion, in order to gain more competitiveness and further development for Chinese pharmaceutical companies, rent-seeking activities should be cracked down. Thank you for your listening.